We're on the topic of health care. What is your position on the Affordable Care Act? And this is an interesting one for you as an attorney. Did the Supreme Court rule properly in its review of this law?
The Affordable Health Care Act is a train wreck. It is a job-killing, legislative scheme that is just bad for our country, and it's bad for our state, it's bad for individuals, and it's bad for employers. To answer your question, Chief Justice Roberts got it wrong. He was applying a principle under the Commerce Clause to validate the Health Care Act and come up with a reason why it wasn't unconstitutional, and I clearly think, as it relates to the 10th Amendment and the overreach of the federal government, that they simply got it wrong. The Affordable Care Act should have never been upheld by the Supreme Court, and we shouldn't be living under the burden that we have today. I mean, as somebody who's run a business with 200 employers, I can tell you it's causing us to have to reduce benefits and increase costs to all of our employers. And there's nothing affordable or right about that. And it's causing healthcare institutions to increase the quality of care. And for all the issues that we have in healthcare, which there are a number that need to be resolved, we still have the finest healthcare delivery system in the world, and it needs to remain so.
I mentioned at the beginning that Obamacare is one of the issues that I'd want to nullify in the state of Texas, make sure that it's not implemented. I know that there were some good selling points on the idea of affordable health care. One of them was the idea that insurance companies would have to cover you if you had pre-existing conditions, and I know that's something that a lot of people with pre-existing conditions really like. But the problem with the Affordable Health Care Act was that exactly it's not affordable, and a lot of employers that have a lot of employees, they have to either cut their hours so that they wouldn't have to provide for that, or basically find other ways around it. What I really want to do is I want to get government out of healthcare. I don't think for me the Health Care Act was basically a bailout for the healthcare insurance industry, requiring everybody by law to have to purchase something whether you wanted to purchase it or not. So really, I think healthcare should be between a doctor and his patient and the patient's family. I don't think anybody else should be involved. I don't think we need to go poking our noses into whatever else somebody else is doing and what your health issue is, and whether it's something that I need to be as somebody in government needs to be informed about. It's something that's personal between a doctor and their patient. That's who it should be. They should have that confidentiality. So for me, get government out of healthcare.
The Affordable Care Act is another example of the federal government hurting people. 5 million people have lost their insurance. And for those that are paying your premiums have gone up. I mean, it's more than a train wreck. I mean, it's a really sad reflection on the destruction of socialism and what it does to people. There are people out there today that are hurting because of that act. But what we need to do as conservatives is we need to come up with what's our alternative, right? And one of the things that we need to do is we need to stop looking at insurance as a metric. Who has insurance? Who has insurance? That's a really bad metric because it implies that if you don't have insurance, you don't get health care, and that's not true. If you look at the nonprofit community, if you look at the benevolence of our local churches, if you look at the donations of our medical society, if you look at what counties are responsible for, people do get health care even if they don't have insurance. We've done some very innovative things here in Collin County. It's called Project Access. And I've been working with the Texas Public Policy Foundation over the past 6 months to craft legislation that will be an alternative to Obamacare in the state of Texas. And it'll be another example where Texas is another great example to the nation as far as how things should be done. And what it does is it creates an incentive for doctors to donate their time like they do here in Collin County. And I've talked to dozens of doctors and their medical society. I've talked to the hospitals. Doctors cannot stand working with the federal government when it comes to Medicaid, Medicare. The accounting, the paperwork is just a nightmare. What they would love to do is just have the option to opt out of that. Don't even mess with Medicaid, Medicare. Don't mess with the federal government. They'll just donate their time and empower counties to either provide tax relief for doctors that participate or help with the retirement, or, we'll just provide that for flexibility. But we have a real opportunity in the state of Texas to show the conservative alternative to Obamacare, and that's in process right now.